Welcome to The Explainer. Today we're diving into something truly revolutionary for sickle cell disease, a new approach from Dr. Sota Omogui that is completely flipping a century of medical practice on its head, and it has the potential to change millions of lives.
So to really get why this is such a huge deal, you gotta start with a pretty grim reality. For over 100 years, the median age of death for men with sickle cell disease has been a shocking 38 years old.
And for women? Well, it's not much better, coming in at just 42.
Okay, let's just pause on that for a second. Some research shows that for adults, the mortality rate has actually been getting worse. So you have to ask yourself, why, after a whole century of medical attention, are we seemingly going backward?
Well, the answer might just be that we've been fundamentally misunderstanding how a sickle cell crisis even starts, and a recent discovery has completely rewritten the rulebook.
Okay, so here's the big aha moment. We've learned that sickling isn't like a switch that flips and it's suddenly permanent. It's actually a two-stage process, and that first stage, where the cells just start to change shape, is totally reversible, but only if you get oxygen back into the system fast enough.
This is what led Dr. Sota Omogui to discover what he calls the golden half hour. Think about that, a crucial 30-minute window where getting oxygen can literally stop a crisis in its tracks. It can prevent it from ever becoming that irreversible, organ-damaging nightmare that sends people rushing to the hospital.
And this is the massive shift in thinking. For 100 years, the model has been completely reactive. You wait for the disaster, then you try to clean up the mess in the hospital. This new model is all about being proactive. Use simple home oxygen to intervene during that reversible first stage and prevent the crisis from ever even happening. So what does this actually mean for the person living with sickle cell every day? Well, it changes everything.
It's all about shifting the power dynamic. Instead of being a helpless bystander just waiting for the next crisis to hit, you're empowered. With the right knowledge and tools, you become your own first responder.
And here's the game plan. We know sleep is super dangerous, right? That's when your oxygen levels naturally dip. So the protocol is actually pretty simple. Using an oxygen concentrator or a cylinder with a nasal cannula, you just inhale oxygen for as little as 10 minutes or even all night long at these really specific low flow rates.
But hey, it's not just for when you're sleeping. This proactive approach is for any time you face a known trigger. Hitting the gym hard, cramming for an exam, getting caught in the cold, or even fighting off an infection. All of those are your cue to use home oxygen right away to head off sickling at the pass.
Flying is a huge one, and honestly, a lot of people don't think about it. When you're in a plane, the cabin pressure is like you're standing on top of an 8,000-foot mountain. That drop in oxygen is a massive trigger for sickling. But the fix is so simple. Just use supplemental oxygen while the plane is taking off and climbing.
Now, home oxygen is definitely the game changer here, but it's not a silver bullet. It's really the cornerstone of a whole proactive toolkit. So, what else is in this toolkit? Well, you've got your must-have vaccinations for things like pneumonia. If you're in an area where malaria is a risk, effective anti-malarials are key. A fixed, low dose of hydroxyurea, and of course, just smart, healthy lifestyle choices. It's all about creating layers of protection.
Okay, I need you to listen to this part because it's super important. A lot of people have those little pulse oximeters at home, and they see a number over 90% and think, whew, I'm good. That can be dangerously misleading. Because of how sickle cells affect blood flow, your reading can look totally normal while your body's tissues are literally starving for oxygen. It gives you a false sense of security.
So, what if you do everything right? You use your oxygen, but that pain just isn't going away. What does that mean? That's a huge red flag. It means you get to the hospital, pronto. Something else is going on.
And once you're there, it's not just about pain meds anymore. The doctors need to become detectives. They need to run a full diagnostic panel to hunt down that root cause. Are we looking at severe anemia, a hidden infection, malaria, a reaction to a transfusion, or even pneumonia?
And this right here, this is absolutely non-negotiable for patients, families, and even doctors to know. We're talking about the right way and the wrong way to manage pain in the hospital. Pain needs to be controlled immediately with pure opioids like morphine or with ketamine. But just as important is what to avoid. Drugs like pentazocine and tramadol can actually make things worse. And critically, you have to avoid overloading with IV fluids, which can cause deadly complications.
Okay, so this all sounds incredible in theory. But what about the real world? Does this proactive, at-home approach actually work? Let's look at the data.
Well, a groundbreaking study out of Nigeria gives us a pretty jaw-dropping answer. They basically tracked a group of patients for 6 months before they started using home oxygen, and then for 6 months after. And the results, wow.
Get this, a 79% reduction in hospitalizations. Just let that sink in for a second. Many of these patients went months without a single trip to the emergency room.
And it doesn't stop there. They also saw an 80% drop in the need for blood transfusions. I mean, this isn't just a small improvement. It's a total game changer.
It really all comes back to Dr. Omagwai's simple but powerful motto for this new era of care: let oxygen be your medicine. It's about using this fundamental element not just to treat symptoms, but as the main tool to prevent the disease from ever taking hold.
You know, this whole discovery really forces us to question decades of medical practice, and it leaves you with this one kind of stunning thought. After thousands of years of this disease and a century of just reacting to it, could the answer, the real key to prevention, have been as simple as the air we breathe all this time,